What's the best thing about being a nurse?
One of the reasons that I became a nurse is the flexibility, the opportunities to change yourself and what direction your career is taking.
I think the best thing about being a nurse is being in the most trusted profession. Instantly, when you tell someone that you are a nurse, you're respected. Often people are thanking you, and then of course sharing their own healthcare stories.
I think the best thing about being a nurse is the rewards you get from those patient interactions and knowing that what interventions you did made a difference in their life at somebody's most vulnerable point or most uncomfortable time. That really seems to me to be the best reward.
For me, it's the feeling that I did the best job that I could to help move people toward wellness. Having an impact in people's lives is immeasurable. It's just wonderful.
What does the future hold for nurses?
15 years from now, I think telehealth will be the standard for our primary care health needs. Really just receiving care almost in a fashion similar to a Skype interview.
And for monitoring care at home, I think for our older adults who might not be able to get out, to be able to send some information electronically or visit with their provider electronically, that's an important part. And also for our rural population that just doesn't have access to a physical doctor's office to go to.
There's an emphasis on community-based nursing. The population is aging and there's more chronic illnesses, and so with technology tying into that, there will be portability, mobility of some of the services that we can bring into the home.
What's the most challenging part about being a nurse?
I think the most challenging part of being a nurse is all of the roles that you have to fulfill.
I think a challenge and an opportunity in the role is that as a nurse, it's your professional identity and it's also your personal identity. And it's a good thing, you know, but it's just maybe a little bit of a challenge sometimes to separate.
What advice would you give to yourself starting out?
Advice I would give to myself or any nurse starting out, keep yourself open to opportunities. Sometimes things get dropped in your lap. I think those experiences expand your breadth and level of expertise and really kind of help you take the next level in your career.
I had big ideas of what type of nurse I wanted to be at the bedside, like on the TV show ER. And then as I continued on in my nursing career, I found out about roles that I didn't even know existed. And you only find out about those things by attending other conferences or opportunities.
As a new nurse, you probably have some reservations about, am I qualified to do that next job? Am I qualified to take the next step in education? And what I know about nurses now is we can do anything that we set our minds to. Set some goals and just go for it. You have all the skills you need to be successful.